So I'm going to talk to you about how to release your diaphragm. Now, your diaphragm is a breathing muscle that we honestly don't always use as well as we should. So what can happen is if we're under stress, for example, we end up using accessory muscles in our neck and our shoulder area to breathe. And sometimes our diaphragm, the primary breathing muscle, gets neglected. So with this neglect comes some tightness and some knots inside our diaphragm. And then when we ask our body to actually use it, we struggle. So one way to release your diaphragm, or at least to explore to see if it needs to be released, is to use mobility tools such as these balls here. Now, everyone likes a little bit different size when they do this activity. I prefer to start with a bigger one. And I'm just going to place it underneath my abdomen here. And I'm going to explore through my abdomen, along the borders of my ribs, and just notice if there's anything that's tender or tight in there. Now, of course, with this big ball, I'm getting more than my diaphragm, and interestingly enough, our abdominals, our rectus abdominis, for example, and our obliques can have some tightness in them too, so you get a little bit more bang for your buck with this, and just kind of notice what you notice. If anything feels tender or tight, spend a little bit more time there, or just simply rest over the ball and try to release it, just like any other mobility work that you would do in your body. Now, I can feel a little bit of tenderness on this part of my abdomen. So what I like to do is then take a smaller ball, like this size, for example, and just get, right, the diaphragm is up and inside your rib cage there, but if you can get this fascia and this connective tissue around the ribs moving with the ball, it can help release your diaphragm. So I'm gonna take the medium one, and I'm gonna go right underneath my ribs there, in that area that was slightly tender with the bigger ball, and I'm just gonna wiggle until I find a spot, and then just rest. And honestly, what I notice is some tenderness there, but also a little bit of a radiating ache up into my rib cage. I don't know exactly if that's a referred muscle pain or if that is some fascia stretching. It doesn't matter. This is helping releasing this tight tissue so that when I ask my body to activate my diaphragm or my abdomen, it simply works a little bit better. Now, some people prefer a smaller ball. You can play around with whatever works best for you. One little piece of advice I want to mention is right where your rib cage comes up through here, there's a little bone called the xiphoid process. It's tiny, there's just no need. I would just, for safety, not take a really hard ball and go right in there. I'd hate for you to injure that bone or accidentally fracture it, for to be terrible. So just stay along the borders of your ribs and even use the balls to release your abdomen. It's good for digestion too. Have fun with that.